At some time this week, the plan is for this London makeshift hospital to be open for business, with 500 beds and an intensive care system in place. No one is downplaying the urgency. Today's figures for virus fatalities is up again, less than yesterday, yet still by over 200. But Channel 4 News has obtained a letter from the CEO to staff at one London hospital trust, which makes the claim that in reality, numbers are higher. At one point it reads, "I am aware that the number of deaths being reported at King's Hospital in national figures is below that which we have experienced. We and a number of other trusts and sectors with a similar problem have alerted the centre to this issue." At what point are we being given accurate, up-to-date figures on the numbers who have died?
It is inevitable that there will be a time lag. This is not an issue of transparency. It's an issue of ensuring that all those families that need to know and all the parts of the system can consolidate the information and ensure it's accurate for the public.
Reinforcing the lockdown is the government's #1 priority. The Prime Minister is writing to every household in the country. In the letter he states, "It's important for me to level with you. We know things will get worse before they get better."
I can't make an accurate prediction, but everyone, I think, does have to prepare for a significant period when these measures are still in place. And the response so far from the British people has been fantastic, as I say. I wish I could predict when this will end, but it's vitally important that at the moment and for weeks ahead that people maintain the strict social distancing guidelines that have been laid out.
At this afternoon's Number 10 briefing, there was talk of the lockdown lasting up to 6 months.
Probably over the next 6 months, we will have a 3-week review. We will see where we're going. We need to keep that lid on, and then gradually we will be able to hopefully adjust some of the social distancing measures and gradually get us all back to normal.
Derbyshire Police, whose drone warning video caused such controversy, were shaming, if not naming, again online. This time, a house party with karaoke and a table laden with food. Hosts dealt with, the tweet said, for what's described as a complete disregard for the rules. The vast majority of the country's cities and towns were deserted today. The question is, can the stay-home policy be sustained for up to 6 months or more?
Well, as we've heard, an NHS consultant has died after testing positive for the disease. Amjad Al-Harani was an ear, nose and throat specialist at Queen's Hospital, Burton. He died last night at Glenfield Hospital in Leicester. The family of the 55-year-old have paid tribute to him, saying he was a loving and much-loved husband, son, father, brother and friend.
Can I also give my deepest sympathies to the family of Dr. Al-Harani. We heard the news just a few moments ago that he'd very sadly passed away.
Well, joining me now is Professor Tahir Massoud, who's a consultant physician at Nottingham University Hospital's NHS Trust and the president of the British Geriatrics Society. Professor, this first death of a frontline consultant will send chills throughout the medical profession.
Yes, it's really saddening news that we've heard today, and my condolences, of course, go out to the family. And I think you're right. It has already, there's a lot of anxiety in the frontline staff of all grades about the risks that they're taking. But I have to say, Krishnan, that I'm amazed about my colleagues up and down the country, all healthcare professionals who are putting themselves out to look after patients at this time. And I know of many instances, for example, where NHS staff who should be actually isolating for 3 months because they fall into one of the categories that the government has said should stay at home, but they insist on working in the front line and putting themselves at risk.
And what is your experience of what's going on in hospitals and how has it changed over the last few days?
I think there's been a big sea change. In my own trust in Nottingham, I think we are 1 or 2 weeks behind the curve compared to the big cities like London and Birmingham. I was on call last weekend and it was busy, but it felt like a calm before the storm. But I've been in touch with my colleagues who have been working this weekend, and the storm has certainly started. Lots of people with suspected COVID are coming in, and there have been deaths.
Now, obviously, you're a geriatrician. Many people are very worried about how elderly relatives are going to be treated and whether they will be treated the same way as everybody else. What's your understanding of that? Well,
I think it's really important to understand that each older person is an individual. And so a 75-year-old, very fit older person will be different from, say, somebody who is 68 with lots of other comorbid conditions, such as heart failure, chronic lung disease. So it's important that we don't decide on who's going to, for example, have intensive care treatment purely on the basis of age alone. But age is, of course, a factor, because as you get older, your immunity does decrease and you're more likely to have chronic conditions such as the ones that I've stated: heart failure, chronic lung disease, diabetes, and so on. So I think that has to be taken into account, because those people, they are going to have a less favourable outcome, no doubt, with COVID as we go into the future.
And just briefly, sorry to interrupt, but just briefly, I mean, do you have the protective equipment that has been promised that you need and access to ventilators?
Well, we do have the equipment, but we do hear, the British Geriatric Society, we are hearing instances up and down the country where some staff feel that the equipment is not being available at the right place. So I think it's really, really important that the management of each hospital and each trust makes sure that the right level of equipment is available at the ground level at that point.
Professor, thank you very much indeed. Well, the Welsh Health Minister has echoed Michael Gove in saying coronavirus restrictions could last weeks and weeks into the future. Vaughan Gething has also been addressing concerns over protective equipment for NHS staff. Our Home Affairs correspondent Andy Davis is in Cardiff. Andy.
Krish, there's been an increasing focus in recent days on the number of field hospitals being established to deal with the peak at the time of the outbreak. And we know about the Excel Centre in London, we know about the Principality Stadium not far from here in Cardiff, among others. And what's emerged today is the scale of the preparations in this context. The Welsh Government saying that it's hoping to establish an extra 5,000 hospital beds to relieve pressure on the acute settings. Interestingly, not all the health boards are going for these big stadium conference-style facilities. One health board I spoke to is looking at more medium-sized, fortified medium-sized locations, and we'll be speaking to the military in the next few days to help them with that. On the issue of personal protective equipment, or PPE, such a contentious issue. Again, the British Medical Association here in Wales has been expressing concerns that they're getting increasing number of anxious calls from frontline workers about the provision of supplies. One hospital doctor saying to them that he only had enough mask supplies to last until the end of today. And that's a subject that I spoke to the Welsh Health Minister, Vaughan Gething, about earlier. There are real concerns still in some areas, despite the assurances you're giving about personal protective equipment, that there are serious gaps still there.
Well, we've distributed over 3.4 million items of personal protective equipment in Wales since the start of this crisis. Over this weekend, about 600,000 respirator masks have gone out to health boards across Wales on top of that. So we are putting out significant amounts of personal protective equipment for our frontline workers.
But will you concede that there are gaps and infection is spreading?
But I do know that there are localised problems, and where each of those come up, my expectation is that health boards deal with them. Now, this isn't a perfect world, and I know that those gaps mean that health service workers and people they're caring for will be understandably concerned, and I am too. So I don't want to try to say that everything is perfect, because I know it isn't. What we will do is what we should do. Continue to deal with all of those challenges as they arise, to resupply the PPE equipment that we have got, and to make sure that the rapid review on personal protective equipment that is taking place, and I expect to see the results of that tomorrow, that we then need to make sure that we provide PPE in accordance with that guidance.
Is there a danger that you will run out of PPE supplies as this outbreak continues over the weeks and months ahead?
I don't think that's going to happen, but there's always a risk that we could see demand outstrip supply in any position, and the whole world is trying to get personal protective equipment. But I think we will be able to resupply, and actually to do that in accordance with the guidance that I expect to come out and to be renewed tomorrow.
So that guidance on personal protective equipment, the review expected tomorrow, and timely given the ongoing debate about what precisely health and care workers should expect in terms of protective equipment, in which settings, and how best to mitigate their exposure to infection. Back to you in London.
Andy Davis in Cardiff. Well, Nazanin Zaghari-Ratcliffe's husband has said her temporary release from an Iranian prison has been extended until April the 18th. Richard Ratcliffe said her file has also been put forward to be considered for clemency. She was jailed on spying charges 4 years ago, but has been allowed to stay in Tehran with her parents during the coronavirus outbreak. The Indian Prime Minister, Narendra Modi, has apologised to his nation's low-income groups after a surprise 3-week lockdown resulted in tens of thousands of migrant workers attempting to return to their native villages. He has been criticised for lack of planning before announcing the curfew last Tuesday, as huge crowds continued to descend on transport hubs such as New Delhi's bus terminal. Some workers have been forced to endure days-long walks to their villages, and many do not have access to food. Now, when Leonard Gibson died 12 days ago, he was one of only 71 people in the UK who had been killed by the virus. Today, that figure stands at more than 1,200. As coronavirus continues to disrupt life across the country, the families of those victims are often left isolated in their grief, struggling to comprehend the loss of a loved one, while also trying to organise a fitting farewell under very difficult conditions. Aisha Tull reports.
He was a very charming man. He was absolutely like one of the kindest people that we've ever known.
Oh, very good.
Many more families are going to lose loved ones before their time.
For Leonard Lenton's family, this became their reality. He was 78 when he died and had tested positive from COVID-19.
He declined quite quickly in hospital. You know, he was in and out of consciousness for a lot of the time. He passed away on the 17th on St Patrick's Day.
Leonard is one of the 1,228 people who have died in the UK. His family say grieving has been made worse because of the coronavirus.
As a general thing, it's just made everything much more difficult, especially with like the arrangements in terms of like registering his death and like the funeral. It's been nearly impossible to do a lot of things because we all had to self-isolate as soon as we found out about the diagnosis, having, you know, had contact with him and things.
These are some of the many families in the UK going through the same. They've paid tribute online to the loved ones they've lost. The current rules for funerals are that they are allowed to go ahead, but only 10 people can attend, and mourners have to sit more than 2 metres apart at the service. Jo Brewer has conducted over 1,000 funerals in her career. Just describe what funeral services look like at the moment.
The chapels are empty. People are desperate looking, sad, unable to comfort one another. Unfortunately, this is what we have to do in order to maintain any kind of funeral service at the moment.
In Italy and Spain, the worst affected countries in Europe, their governments have imposed drastic measures. Italy have banned all public funerals. And in parts of Spain, coronavirus victims are being buried alone. Earlier this week, they announced that a makeshift mortuary in an ice rink is having to be used. In the UK, such measures haven't been announced. And for Leonard Lenton's family, they want him to be remembered as a person, not a coronavirus statistic.